Good morning.
Good morning.
Frank.
Morning, Lorraine.
And do we have Fiona yet?
Yes, I'm here.
Oh,
Morning,
marvellous.
everyone.
Good morning, Fiona.
Morning. All right.
Right.
I've just texted and it didn't go through. It's just not delivered.
Oh. And where are
Sorry,
you
could I
from?
have the code again, please? For the Mentimeter.
Sorry, say that again.
Could somebody shout out the code for the Mentimeter? Because I put in 2233 and it didn't come up.
So that's the text. If you're using a mobile or the internet, you go to polev.com and then type in this thing at the top, Jazz Do 393.
Just sound like a dance move, doesn't it, Marie? Jazz
Yeah.
do. You
I don't know. I think
sort
it randomly generated that name. I
have
don't know where it
exercise
came
on a
from.
Friday morning.
Can that
Yes.
be in the chat?
And it is now in the chat. Yeah.
Oh, yeah.
Goodness me, it's not rocket
It is
No,
for
but
some of us. Look,
it is rocket science for us.
some of us remember a pre-mobile phone world. Some of us still exist in it half the time.
That was for my husband, not for you guys. Although it's actually timed.
I remember when the only people in the office with a computer were the admin assistants.
I
That's
wish
how
it
old
was the
I am.
case sometimes.
We didn't
All
even
right.
have any computers in our offices, Amanda. It was little card decks,
Don't forget that.
not even notes.
Right, Christine,
Anyway.
we are at 186. I think you should lead us off in some wise words.
Fair enough. I think that's true. Good morning, everyone. Really, really pleased to at least know that you're there, even if I can't see that you're there. But the participant list tells me you're there. And it's good to see people from around the country. And it's also always really, really good to see the mix of people from different professional groups, both professionals and parents, from health, from social care and from education working together. And that's brilliant. The themes of our conferences are always the same, really. They're about integrated care. They're about how we would deliver for children when we can be better than the sum of our parts, and how we keep children and families at the centre of everything that we try and do. It's been a really difficult year. I don't know about you, but if I never look at a Zoom meeting again, I will be a happy woman. But that's where we are. We've had challenges. We've gone through. It's a good day today. In London, the sun is shining. The daffodils are out. Boris has a plan for us to leave lockdown. All good stuff. And what is really interesting is we've also got a real opportunity for change coming up. We always work with change. Change is our one constant. But actually, sometimes change comes at the right place in the right way. I'm glad it's shining in Manchester. And that is about the fact that we have the Scnd review coming up. We have a major piece of NHS law on changes in the NHS coming up. And what runs through all of them in their ambitions is that about integration and partnership. And that's really, really important. One of the things that I really like about these events, because of course I get wheeled in to do things, I'm not involved in the putting together of them, is I then get sent the workshop list. And the workshops always fascinate me because the workshops often demonstrate practice that is in advance of national policy, in advance of national thinking. So I'm really, really interested about the way you are coming together on the ground in different partnerships, using the advantages of the changes to integrated care systems, using the sort of work you've been doing on joint commissioning, on developing effective outcomes, on really looking at innovation. There won't be anybody who will not be happy when coronavirus is over, when the world opens up again and the world feels safe again. But one of the things we've been really keen on, and I know that you've been demonstrating and keen on, and we've been working with partners in government on the same thing, is actually throughout coronavirus, there's been some really innovative, interesting practice, some really good stuff that when we move forward, we're not going to let go of and think about. So even if you think about today, There are now 190 people on this call. If we were running this as an event, it would be rather excitable. It would be extremely expensive. And yeah, this isn't quite what we want to do. And it's not quite good enough to have the chats in the corridors and the chats that do creativity and innovation, but it does pull people together in the same room with the same focus. It doesn't discriminate against those of you who live and work in rural communities, who have childcare, who have things that you're juggling in their lives. So it's some of that learning that we want to... That beeping is me. I don't know how to switch the bloody thing off. Look, I'll get rid of it over here. Amanda told me I had to have my phone on in case she had to send me an urgent message as I messed something up. I'll stick it on the bed. You know, but this has brought us together in a way that we can think about doing. So the workshops today are really exciting. I'm also really, really pleased that we've got such a good group of speakers this morning. I'm really pleased that people have come together and given their time. And, you know, this morning's presentations are a real demonstration of that multi-agency working coming together. Lorraine Mulroney is fed up with me describing her as a powerhouse. She says to me, you tell me that every time, Christine. But she has a single determination for change. And actually, we need people like you. There won't be anyone on this call that is not a determinant for change and wants to understand change and make it happen and make the difference that we want to see. So I am going to start off with our first determiner of change.
I'll see you in a minute. Thank you. Bye.
And that is Lorraine from NHS England. You're being described as a good fairy, Lorraine. How about that for this morning?
That's lovely. Thank you, Christine. Thank you, Kat.
No, that's on chat. Just to remind you, I will try and silence my phone, but if you can remain on mute if you're not speaking, that would be really, really helpful. I am now going to go on mute and hand over to Lorraine. Thank you, Lorraine.
Morning, everyone. And yes, Christine, I like that new description of me. I'm definitely one for change. I feel quite comfortable with change because I think it brings a lot of opportunities as well. So I guess this is it number 4 event that we've had? So last time we were in December and it was pretty gloomy then. So I'm starting off with some of the same messages that you've said this morning. Hello, spring. How fantastic is it to see some of the bulbs coming up and the sun shining? I think it will help us all. But my motto today, because it's Friday and I'm delighted that we've got to the end of the week. It's been a tough week for everyone, but I'm thinking it's better to look ahead. Like you say, Christine, there's a lot to look forward to. There's a lot of good things, and prepare ourselves. And don't look back. It's quite difficult to look back because we can feel all these difficult things. We hear all the experiences. It's really hard for us all. Let's not regret it. Let's take the good from what we've been through and move on and remain positive. Be proud of what we've done as well. I think that's really, really important. So I know that many of you have continued to nurture some of your new collaborative relationships, because I certainly have. We've built a lot more new relationships nationally, even within our own organisation and NHS England, and bringing all together all those children, young people's change agents, as you would probably describe them. So I have a couple of things this morning just to update you, not very much, in terms of what's happening in Scnd. So as many of you know, I work as the national lead for Scnd. I also have a hat, the senior nurse for children, young people. And I work alongside my regional Scnd colleagues across our 7 regions. A couple of them are on the meeting today, so it's great that they've been able to find time to join us. I've got a bit of a celebration, really. Many of you know and who've seen me before and spoken to me, I've been around. It's nearly 5 years since I've been doing this job in June. And I've got to celebrate, and I've actually got to thank Richard Owen, who's on the call today to talk to us a bit later. We've managed to get money out to our regions, particularly for Scnd, to support some of the improvement work that needs to be done from a health perspective. And whilst we're glad of our colleagues at DFE in supporting some of the improvement work, we have been able to secure some money for Scnd this year and hoping to get the new arrangements for next year. And I'm really looking forward to some of that learning that is going to come from regions. Lots of different types of projects, lots of different types of work coming up, but also to increase the capacity of us in NHSE role to support Scnd. So that's my celebration today, and I'm really proud of that. It was a fantastic Christmas present to have, and moving forward. There will be more to come about how we work from April onwards, and I'm really excited at this time about what we're planning, but I can't say any more. So hopefully at the next meeting I'll be able to tell you more about what it's all going to look like. And I guess throughout the last few months, we've been doing the same as you guys have been doing. We've been working across our national partners, looking at the COVID response, supporting each other, making sure that children and young people have a voice in some of the decisions that are being made and taken, looking at it from a national, regional and local perspective. But we've equally been doing some of our business as usual work as well. And I would like to say thank you to my regional colleagues and those locally who have been working to support children and young people with Scnd and their families, and the system who supports them. So looking ahead is the message of today, I would say, and many strategies, many new things coming. So waiting on the autism strategy, waiting on the news around what's going to happen with the NHS bill, and obviously the big ticket item for us is waiting on the Scnd review. So it's very exciting, but it's equally a little bit daunting. So I hope you really enjoy the rest of the day. I'm looking forward to the workshops as well. Christine, I totally agree with you. Every time I look at the list, I think, wow, we have so much to learn. We have so much to share. And I hope everyone has a great day and comes away with some things that they will take back to work on Monday. So that's all from me, Christine, and I will move on.
Thank you very much, Lorraine. It's always good to hear from you. For those of you who managed to do the poll earlier, we've got another one for you. Okay, so we've got 2 questions on the poll. I'll get somebody to put up the link in a minute, and Daphne or Marie will write it for you in chat. And what we're trying to work out at the moment is something quite simple. It's got 2 questions. The questions are, what is it that keeps you awake at night? We want to know the things that worry people. But we also want to know, what is it you're proud of? You heard Lorraine rightly talk about being proud of some of the things we've all achieved over the last few months. But we're really keen to understand what's keeping you awake at night. Here they are coming in. DFE revisits. Yeah, it's a good job we've got Fiona next. Tribunals, Scnd support, waiting lists. Yeah, that's one of the things we're worried about in terms of Scnd recovery. I don't know, retirement's what puts me to sleep at night, not what's keeping me awake. Okay, waiting lists, yeah. There are some themes, are there not? Yeah, really interesting, some of the themes coming up. And they are, I hope it's not your snoring. Yeah. One of the things that government has been keen on looking at, and one of the things we are working with them on, is this whole stuff around what does a Scnd recovery plan look like? Not just a Scnd catch-up plan, not just about academic achievement for young people, though that of course is important, but about what does recovery look like? What does it look like in terms of tackling some of those waiting lists, understanding capacity in therapy, understanding how we come together, etc. And look, yeah, there's some very common themes on this one. I'm hoping as well, we have got the Scnd review on the call this morning. I asked them to come and join us just to listen to this and understand where you were and the things that were happening to you, so that we could have a look at making sure that as we move forward, things are responsive. And I suppose one of the things that's really interesting for me is a lot of these are the things we've seen for a long time. And what COVID has done is actually what COVID's done as it's magnified where the challenges are, really. And we see that. We are going to have a word with those tribunal judges, though. Tribunal seems to be coming up a lot. One of the things we'll do, I know that this is moving at speed, but one of the things we'll do is actually we pull this together. So at the when we come back to you after this conference, we come back to you with presentations, workshop slides, all of the things that you'd expect. But we'll come back to you with also a sort of summary of the things you told us that were keeping you awake at night. There's a lot of stuff about capacity, isn't there? What do you mean, new guidance? I think we've had 44 new sets of guidance for schools in the last few months. Okay. Yes, Aileen Fitzgerald, you're quite right. We are looking in detail at the new NHS world and making sure that children are not lost in it. Okay.
Shall we move on to the other one, Christine? I just don't want to.
Just what I was thinking. Because there are very common themes on this, and we will put those together and have a look at you. Tell us what you're proud of. The machine tells me you haven't responded yet, and you really need to be proud of some of the things. Listen, if you want to write getting to Friday in one piece, that's fair enough to me. Yes, we've seen some fantastic responses to COVID. We've some really innovative, creative ways of working. I'm delighted you have a new DSCO in West Sussex. That's absolutely brilliant. Yes, excellent. If you analyse what's happened to COVID over the last year or so, one of the things that we see is that sort of where people can work together well and where people understand each other's strengths and limitations, then actually we have seen some fantastic stuff. It's really, really demonstrated that joint working, joint relationships, trusting one another to make the difference has actually been the bedrock of what we've done. And thank you, Future Me Gloucestershire Youth Representatives. That sounds fantastic. Good stuff. All right. Excellent.
Well, we can leave that poll on in the background, can't we, Christine?
If you tell me we can, Amanda, I'm sure we can. Okay. Actually, this poll's a really good introduction to Fiona. I am delighted that Fiona has joined us from the DFE. Fiona leads the intervention and improvement work in SCND at DFE, came and joined us at the start of lockdown, and I've been really, really impressed at the work that Fiona's team have been looking at, both throughout lockdown and the challenges within it, but actually seeing beyond it and understanding what recovery and improvement will mean. So I'm really, really pleased, Fiona, that you have joined us this morning.
Thank you very much, and thank you for inviting me to this event. I think several of you have stolen some of my strap lines. I had them all prepped in terms of COVID has allowed us to seize the opportunity, etc. Coming together in this way, as you said, it would be so expensive and so difficult to get this many people together at an event, but also the opportunities that have come out of this this pandemic, which I'm sure, as you have said, we can't wait to see the back of. But there are so many things that we can learn and take forward from this, and it is very much about what do we mean when we talk about recovery, and what is that going to enable us to do going forward differently, and what learning will we take from this situation that we've been in for far too long. I want to use my time to touch on the offer in general, but then, as Christine has said, because intervention and improvement is my focus and the focus of my team, I do want to spend a little bit more time talking about where we are now and our direction of travel. So just to go to the next slide, please, and thank you, Marie. I think you're handling the slides for me. Thank you so much. So I think it's clear to everyone, and I don't think this is any surprise to anyone, that actually what we're trying to achieve here, and what many of you are, and I think Christine touched on this as well, you're often far ahead of the policy, and it's so important for us to recognise that and to try and harness that. That's so important again, that we do that as we go forward. But what we're all trying to do is keep the child, the young person and their family central to all of this. It's about making sure that families and children and young people get the right services at the right time, and that's so that they are able to receive the support they need from all the delivery partners and services, that provision runs end to end, so we make sure that we're delivering at the front end, so to speak, so that people have access to services and are kept out of the system if possible, but that where they are, their needs mean that they do have to be part of that system, that their needs are met in a timely and effective way. And I think that's really, really important. It's central to everything that we do, because underpinning all of this is to make sure that the outcomes for all children and young people who have some form of special educational needs, and that spectrum is so far reaching, as you all know, is that they're able to achieve their full potential. And I'm sure that the sister enablers that I've put here are no surprise to anyone. I will give kudos or credit to the ICSs partnership, but I think if we're looking at any system, the ability to deliver effective and high quality service is subject to that system being able to support that and enable that. And those enablers here that I've just listed are about making sure that there is a good strategic approach. So making sure, for in this instance, that Scnd is everybody's business, that workforce has the confidence, is equipped and enabled to deliver to a high standard. Those partnerships are really strong. We've got so many of our partners on the line today, and I think nothing would work without bringing those partners together in the right way at the right time, and those relationships building and evolving with time as well. Those practice and systems must be embedded and flex and change. I mean, COVID has definitely demonstrated that need to flex our approach, and that builds into the need for innovation and a culture of improvement, that mindset that runs right across the system and through everything that we do. And of course, nothing is possible without judicious use of resources. And I've seen that run through that we just had now, people talking about high needs budgets, spend, etc. And these are all the things that we need to think about as we go forward. So what is the offer? Next slide, please. I do feel a bit like the PM saying next slide, please. I've always wanted to do that, so here we go. So what is the offer? I think in a sense, for simplicity, and I don't say that flippantly, but for simplicity, we brigade it into three areas. We have that universal offer, which is very much about making sure that as I said, Scnd is everyone's business. It's about inclusion. It's about, because most of our provision works through education settings, not all of it, but most of it, that those settings and the staff within those settings are equipped and are able to be inclusive. It shouldn't be that we have in a sense, see this as an issue and a problem that sits somewhere separate. It has to be about inclusion, and everybody needs to be confident. So we have Whole School Scnd through NASEN, we have the Autism Education Trust, we have the Education Training Foundation, all working with colleagues, with the workforce, to make sure that they understand how to make this system inclusive. We then talk about participation, and here where we have the information and advice, it's about that co-production, it's about that partnership with parents and carers, children and young people, and working through the system as well. It's about the Parent Carer Forum, it's about IPSI, it's about Sendias, and I will apologise if I haven't got the logo down the side and or infringe someone's copyright, but I just wanted to reflect how many people are involved in these contracts and grants that we provide across the delivery partners and across services. We separate this into three categories, but actually they're all intertwined and interdependent and interrelated, and you see that particularly when we get to targeted support, which is very much about where we're working with local areas where there's been an inspection and significant weaknesses have been identified, and we want to support them through that system through their improvement journey. And I will, as I say, focus a little bit more on the targeted support. But just to go to the next slide, please. Just to touch a little bit more. Sorry, Marie, can we move to the next slide? Is that all right? Thanks, brilliant. So just to touch a little bit more on the universal, and as I said, this is very much about inclusion, and I won't go into too much detail here because I want to leave a bit of time at the end for, if possible, a bit of discussion about the direction of travel. But I think what we're seeing here and is that sort of where we have that regional approach, and you'll see that what I've tried to do is thread through those enablers that play out in these different areas. So in the universal, for example, we're touching on enabling that workforce. We're doing it through a strategic approach where you have regional Scnd leads across all the 9 RSC regions, and it's about building that community of support, those networks, sharing practice, what works, what doesn't, and that continuous professional development. And you can see there are examples here that impact is felt and it's strong. And going back to the impact of COVID and how we've had to flex to do things differently, you've had over 6,000 attendees at events over the year, and I think this is really testament to how everyone's pivoted what they need to do to keep the show on the road and make sure that that support is continued. This community of practice has 15,000 members. That's amazing, and I think it shows that there is that will, there is that desire to make things right, and that's a thread I know that runs through all the work that all of you are doing. So for which thank you, and we have so much to learn at the centre and how to harness that and bring that together. So I'll just move on to the next slide, please. So Marie, thank you, Brill. And again, that's seen in our participation. This is where we have the improvement and advisory program, support program. It's delivered through a very strong partnership. I'm not biased or trying to please anyone, but this is the Council for Disabled Children, and then the Contact, ICSs as well, all working together to make sure that people understand what, in a sense, their rights are actually, and what services are available to them, what they should be able to access, but also what is right and what they should expect when dealing with a setting. And so what the example I have here is a very personal one in terms of the case study showing that we have Mr. M here. His child has been excluded. It's understanding what the problem is here, feeling that he's not in a strong position, and that sort of understanding about what the compliance should be in the part of the school, understanding therefore that this is how I take things forward in terms of concerns, etc., knowing what is right and what isn't, and therefore being confident and able to make sure that that support is enabled in the right way. And I think this is a key thing that runs through this participation. It's about everybody being involved so that you get to that point where you have the right support at the right time. Again, that thread. So it's about strong partnerships and their overarching approach to delivery. And I think you see that again. This is a personal one, but also you have that a sort of staff level working with a local area where, for example, we know of areas that have put a strong focus, put in advisory groups so that they're able to get that dedicated resource to make sure that that information and advice goes out in the right way at the right time, and that there's training available so everyone understands the legislative framework and knows what they're supposed to do and when. So this is again something that shows that thread running through. How do we make sure we keep this going? And then turning to targeted. So the next slide, please. Thanks. And I think this speaks very much, as I said, to the how we show that everything is interrelated and integrated. And I think this is the real strength here, where we have those local areas who are on that improvement journey. And it's not just in the main, and our focus over the last year in particular, because we've had to try and manage business as usual whilst managing that response to the pandemic and all that that's thrown up. But I think it's testament to all our delivery partners, CDC, NDTI, Whole School Scnd, etc., how they've come together to make sure that we are still able to work with those areas that were struggling before, and others that continue to have challenges in terms of how they deliver their services effectively. And there have been significant challenges. We are completely aware of that in terms of timeliness, in terms of being able to meet statutory duties, given that there are so many pulls on people, or, for example, schools have been closed or where they've been open not fully, and so on. So this is, I just wanted to play in an example here. It's about, here we're talking about just getting the basics right, making sure that those EHCPs are fit for purpose, that they are assured, and everyone is trained, and that audit takes place so that they work effectively. And so therefore that end-to-end, the end user understands, and here we have the Parent Carer Forum, where they understand that they're working with the system, working with that local area, so that there is that confidence in the system and confidence in what's being delivered. And there's so many other ways that that plays out. It plays out through the provision of advice in terms of securing health advice for EHCs, the auditing tool. It's about that designated clinical officer and medical officer resources that are available to make sure that that joint commissioning is effective and services are provided. It's about making sure there is a proper outcomes framework. And I think if we just move to the next slide, you can see that how there is an element of how that all comes together effectively. Just some examples that we showed here, where there's an effective leadership and governance, there's that partnership, and there's a strategic approach. Providers are embracing the area's approach to improving Scnd. There's that strong connection with the CCGs, being proactive. The CCG has made sure that the designated medical officer role has sufficient capacity so that we're able to get that provision in across to everyone. But now if I could just move to the next slide. And this focuses and starts to, and this is the area where I really want to build on. We've talked about recovery, and we do know we want to do more. We need to do more. There is so much going on, but how do we bring this together as we move into the next phase, moving from the sort of firefighting in a sense into that real business as usual? But what is our business as usual going to be going forward? What is recovery, and how do those two intertwine? We know that despite the reforms, and I'm not telling you anything that you don't know already, that there's still those key challenges that remain. There's been high spend, and how do we manage that demand? How do we do this more effectively going forward? The Scnd review was announced, it is in play, and there are such expectations. I don't know how many of the team are on the call, but there's such high expectations around that. But it's not, it's ongoing. And so we have to keep the system and business as usual ongoing as well in the interim, but we have to deliver in a way that allows us to flex and pivot for the outcomes of that review. And so what I've put here is embed our existing reforms and move to stabilize the system. Can we stabilize the system? I'm not entirely sure, but at least I think that we need to make sure that we're doing all we can. And so what we want to take forward in the targeted element of our support package in particular is a program that continues to develop, and it builds on the existing infrastructure, but starts to also grow to bring in a stronger relationship with social care. For example, we're doing a lot more work with children's social care within the department, and you'll see that when we start to talk about how we look to sector-led support as well as the support of the delivery partners, working through this regionally or at local authority level, local area level, and scaling and spreading that effective practice. I'm blown away, to use the not so professional term, as others have said, about all the different workshops that are taking place today, and how can we bring that together? How can we harness it so it builds our offer? And I do have, if you turn to the next slide, the phrase exactly that Christine used, that being about more than being the sum of our parts. So just to go to the next slide, please. And I very much mean this, and you can see I've pulled the enablers together, and I'm talking about how going forward what we want to do is think about, and this is one for consideration, discussion, hopefully, how we want to think about where we have those local areas that have significant weakness. How do we start to bring that suite of support, that package of support together so that it's more and intensely outcome focused? So all those partners working against a trajectory of improvement, end-to-end support for local authorities. So that diagnostic at the beginning between the Scnd advisors, who we are continuing to work with, where would we be without them, NHSE as well, the advisors coming together and saying, okay, what is that plan? How does this plan take shape? And when and where do we need to put in that support so that we have that end-to-end journey that suggests that this is everybody's business? How does that interplay? So that suite of support will respond intelligently to specific weaknesses in local areas, but it's not just about that working to the test, so to speak, the revisit that so many put up, you put up as something that you're worried about, or new inspections. We need to think about how is this a sustained improvement journey? It's got to continue. And yes, it may be that it's instigated by an inspection, but actually let's make sure it goes beyond that and it's strengthened and supported. So harnessing, as I've said, that collective knowledge of which there is so much. What are those models of effective practice? How do we make sure we play that back? And how do we evaluate those and understand the impact that they have across the system to improve the experience of the children and young people and their families? How do we make sure, therefore, that at regional level, whether it be through whole school Scnd, those structures, whether it be for the regional coordinators, whether it be through the NHSE activity, looking to bring together DCMOs, DMOs alongside other partners. How do we make sure that that all is strategic and throws back into the leadership and decisions that are made for that strategic approach? Particularly, again, looking at funding, how do we make sure that that strategic approach includes all of leadership right across children's services so that we know where things are playing together and make sure that works as well. I think that I'm going to leave it there. I hope that's given you a good sense of what we are looking to do. I could have touched on so many more areas, looking at sort of how those specific packages have delivered in different areas, but I know that you're going to get a lot of that through the day. So I don't know if there's, but I think there's some time for questions and I will try to answer them as well as possible. Thank you.
Buttons. Thank you very much, Fiona. We have had some questions in the chat.
I can't see the chat at the moment. So.
No, don't worry. I've had a go at them, so I'll go through what I think we've got, and then we can have a look and people can put in if you think that I've missed the point. Okay, so I think there's a theme about schools coming through, about how do we support children with SEN needs in schools when some of the other bits of schools feel like they're working against them. I think people have talked about curriculum, they've talked about some of the pressures on schools and how we make sure that children with SEND can thrive in schools. So that's one area. I don't know if Andre is with us as well, Fiona, but
I'm
that's
not
certainly a thread.
sure. I think I've seen Brian on the call and a few other of the advisors. I'm not sure that Andre is. I know Andre is doing sessions this week as well, but I will try my best. And if other colleagues are on the call, please do come in as well. I don't know why my chat seems to have frozen. It's gone completely blank, which is slightly disconcerting. But yes, I mean, recovery and what next. And we've had several meetings. We've working with many of you who are on this call as to what that's going to look like. And there is a sort of a catch-up program in Train, as many of you know, significant funding being put into that to go out to the system and to the sector. I think the key thing here, and I think something that we're quite keen to take forward, is that understanding of when you sort of say recovery for many children and young people who have SEN, the experience has been very different. And so it is, what are you recovering from, in a sense, and how do we make sure we get that right? Schools, there's some schools who have been brilliant through this whole pandemic, and they've served children and young people well, and we want to build on that. So where they have put there's a improved remote education, but also they've brought children into school and managed to make sure that their provision in the main has been good. And we want to see how we can continue that, and taking into account that there will be some young people who are struggling and don't want to come back into the system. So how do we make sure we accommodate that, looking at behaviour, etc., and mental health as well. So all of that has to be part of that process. And we're continuing to talk to you and others in terms of how do we get that right. And I think the enablers that sit within that, of course, we talk, school is going back. It never closed for vulnerable children. They have been going to school all through this, and so schools didn't close for them. But how do we get that right in terms of the changes that will be as we move more to that sort of solid curriculum, to make sure that children and young people with SEND aren't left behind or pushed to one side? And I think that's got to be the key going forward.
One of the things that's just come in, Fiona, as well, is about specific catch-up support for children with SCND. Do we know more about that yet, or is that still in development?
We are talking with the team, and we're trying to make sure that, you know, it's everyone's business and think SEND. So the specifics of that are still to be worked out, whether there'd be more one-to-one, but there is we are very clear that we want to have that specific explicit focus on children with SEN within any catch-up program. That is very clear, and any funding that's going through, let's make sure that it's not just in mainstream, but also that requirement for special schools, and also what sits around that package around respite, so that parents and carers get that time as well to recover, and therefore are able to support their children and young people more. What that level that looks at just the education side of things, or whether and how that also has to incorporate, as I said, the mental health and social and well-being of those children as well. So it's a full package around that recovery catch-up support.
And I think that's why we've referred to it, haven't we, as recovery rather than
absolutely.
catch-up. I don't
absolutely.
know.
I think I was on a call.
Yes.
Sorry, I was just saying I was on a call the other day where I think the very strong point, and I agree actually, is catch up. And what do you mean by catch up? As I said, some children and young people have actually done better through this process, not all, but some, and so they're not necessarily catching up, but they are recovering from the experience that has been the COVID and all that has gone on within that. So it has to be quite specific in a way for each child, and that is difficult when you're in that sort of inclusive, in the school environment. But I think we do have to bear that in mind. This experience has been different for every child and young person, and so how do we work to that as we bring children back to normality, whatever that's going to be?
Okay, there is an obvious question, Fiona, that I might as well give you, which is, when is the SEND review coming out for consultation? What is the latest information you can give people on the call, please?
In terms of the SEND review, I know that that's coming out soon. I can't give you a specific date. It's annoying, I know. I'm sure for most, but the team are working really hard to get to the point where they can actively send out the next stage for stakeholders to consult on. I'm sure you've heard the minister say that we want this all to be published in the spring. I think she's using daffodils as what, but more seriously, I think that when we say spring, we want this it will definitely be before the end of the next term, and I unfortunately I can't say more than that. I don't know if anyone from the team is on the call, but we want to get this out as soon as possible. It is important. We know that that is something that everybody's waiting for, but also it is, as we move into recovery, how are we going to make sure that that plays into what we need to do next? What role schools in terms of making sure that we, and many of you will know that the sort of direction of travel is very much about what more schools can do in terms of early support, early help, so that there are fewer was going to say fewer requests, and that doesn't, I don't want that to sound like there's a sort of a swing away from EHCPs, which is something that I have seen on social media, etc. It's more about going back to that right support at the right time, and what can we do earlier so that that support threads through, rather than it always resulting in that EHCP where the feeling is that that's the only way you can get support. We want to level that out. We don't want that to be the case, and that's very much the thread that's running through the review. So how do we work more closely with schools in that respect? So the inclusion element, but where that EHCP is needed, let's make that process as efficient and as straightforward as possible. That's something also that we need to be very clear and take forward in that way as well.
Thank you, Fiona. And just a question from people saying what's happening to inspections. You saw people's worry about them in terms of that either haven't been inspected yet or are waiting for revisits.
Yes, so there's two schools here, aren't there? I know that I've spoken with some local areas where they've said, please come back, please, we really want our revisit. We've made so much progress. We want you to come, we want us to come in, or we want you to come back and talk to us and see what we've done. These were paused for obvious reasons. We are really keen to get them back up and running, and so are hoping to take them forward. And we talk about next term, hoping at least to get the revisits up and running as soon as possible, and then we'll move to inspections. We have to, as with everything else at the moment, we have to do this at the right time. Local areas have been so busy sort of responding to COVID and all that has brought. We recognise it's really important. We really need to have eyes on. So what we want to do as we go forward is think about those revisits first, potentially, and then move into the inspection of those that haven't been inspected so far. And then, of course, there is the development and thinking about the new framework, which is that work is ongoing. And so those announcements will be made. But I think in terms of the revisit, it is something that we want to do first of all. I think if we're going to do it in an order, that would be the preference, to get the revisits up and running as soon as possible. So I guess it's a watch this space, and we will get those dates out to you as soon as possible, but we're really keen to get them up and running in the next term. But we have to see how things go in terms of, you know, fingers crossed we're coming out of lockdown, and how that will play, so that we can do things face to face as much as possible, although virtual has worked throughout this, and so we will be continuing to do some of that as well. I was going to say, sorry, just to add, because of some of the concerns, it would be helpful to understand what those concerns are around revisits, I think, but mindful that we have been through this time, I think we will look to take that, and Ofsted and the CQC will look to take that into account in terms of baselining, because we know that things are in a different place. So I don't know if that is helpful in terms of some of the concerns around that, because a lot has taken place, and so we do need to make sure that that is taken into account as well. People will be in different places.
Okay, thank you very much, Fiona. And for those of you who can see the chat, Mike Davis is the chair of the Scnd review team, and has written, "That's right on the review, Fiona. We want to publish as soon as we possibly can. Certainly not sitting on our hands, but can't guarantee it. Well, it will be before the end of the tulip season."
There you go. I didn't misspeak, and I couldn't see the chat.
Not misspeak, no. Thank you very much, Fiona. That is really, really helpful. Thank you for your time. One of the things that's really interesting about a lot of the questions on the chat and the comments is actually the joint working with health. You know, that runs through as a critical issue. The Scnd review is not just about education, it's also about health. There's lots of questions about integrated care systems and how we'll work with them. There's lots of questions about therapy, both speech and language and other therapies, and how we catch up on waiting lists for therapy, and how we think through our therapy offer, and some questions about how we link across with a public health agenda. How do we make this sort of circle of stuff together? So I am delighted that our next speaker will have all the answers. How about that, Richard? Richard Owen is the head of the Children and Young People's team at NHS England, and has been working really hard on some of these things. So we are delighted that you found time to come and talk to us this morning. Thank you, Richard.
No problem, Christine. Good morning, everyone. We there's some brilliant context setting that's already happened in a lot of the talks already and some of the discussions. So that's really helpful. That's going to hopefully mean I can get through my presentation. So I guess there's three things I want to get across before I share my slides. There's three things I want to get across in the presentation. I think it's really helpful that Sue is following me as well, because you'll get the sort of local perspective. You can see if we're aligned. So three things. I think first of all, and this has been alluded to, obviously there's another change coming in the NHS with integrated care systems. So I think the first bit, there's a challenge there for us, as ever with children and young people. How do we make sure that these changes work for children and young people? And we can talk more about that. But I think there's opportunities as well within that. So I think the first opportunity is the groups we have, such as this, and the how we can work together to make sure we make the most of this opportunity coming. And the third thing, I guess, something that we haven't had on the NHS side before, which Lorraine's alluded to, Christine's alluded to, is that we have a sort of children's programme within the NHS now. And what I think the timing of that, hopefully, means that we have a better chance of influencing some of these changes as they happen over the coming weeks and months. So I'll share my slides. This is always a nervous bit. Cool. Can people see that?
Yeah, that's
yeah.
Good.
Okay. So I'll start off. So this is sort of the chapter and verse slide for a minute. So this is quite a busy slide, but I'll talk around it probably. So as Christine said, so one of the things the pandemic from the NHS side and the sort of local system side has been that with COVID, with all the difficult things that the NHS working with partners has had to do over the last year, is that local systems have had more of a I guess a sort of formal role in some of the decisions that have been made around managing and supporting COVID, supporting the vaccine rollout, etc. So, however, I guess we've still been working in quite an odd statutory place in the NHS, in that we've had the Health and Social Care Act. But integrated care systems have been almost working within the legislation, but trying to do in the limits of it, I suppose. So so I guess the opportunity now is, if we can have legislation, how do we put on, how do we put ICSs on a statutory footing, building on the work that's happened in the pandemic and some of the relationships that have improved and been developed during the pandemic. And also for ourselves at NHSE. So I have to introduce myself as Richard Owen from NHSE Improvement. We're a number of organisations that have come together now. Again, the legislation is going to give us the opportunity to be one organisation, and it's going to give our friends at the Department of Health and Social Care the chance to put some more power over us as an organisation in the legislation and change some of the accountability mechanisms. So last year we published a paper called Integrating Care. That was as a consultation. Again, we're in a slightly odd position, I guess, as an arm's length body, in that we were not the ones that can take legislation through Parliament. It's going to be Department of Health and Social Care doing that. But at the same time, because of the way we work closely with the department has almost asked us for our views on what the legislation should look like, how that should work with systems. And of course, we're the ones that work really closely with colleagues such as Sue in local systems to make sure things are done in the right way. So I guess this is almost us setting out a consultation to the department about what we'd like to see in the legislation and getting views on that. And I guess the big thing for this will be formalising the role of integrated care systems, giving them the financial accountability, and making that and replacing CCGs effectively, and bringing them in a statutory footing. So I think that is a change that everyone's wanted to see. But I think it comes to, how do we do this change in a way that's going to work for children and young people? And I'm going to be slightly careful what I say on this part. I think if those that have read the consultation document that came out last year, it was a general consultation document. It didn't really do the job in terms of saying what this meant for children and young people. However, I think there were a couple of thousand responses to this, at least to this consultation, which is impressive in a time that's been so busy for people working across health, social care, education, etc. So my team has gone through all the responses that mention children and young people, and that has been really useful in terms of us being able to create our own narrative and from our side about where we think these changes would need to consider, what needs to be considered for these changes to work best for children and young people. So the next couple of slides are still a draft really of where we think that should be. But again, I think the fact that we had many responses that meant that were concerned around children has been really helpful for this process for us internally, and what we can then take to the department as we look at the legislation. As I said, it's going to go through, these changes will go through a statutory process. There's going to be, debates in Parliament, in the Lords. So I think that's going to be a really interesting way to influence the process as well. So there's sort of 4 things here. So first of all, within, everyone on this call will know, and it will be mentioned already, that integrated care is key for the improvements and outcomes we want for all children, Scnd and others. So I suppose we need to understand what that integrated care means for children. So, I think a lot of the previous attempts on integrated care have been around adults and older people and adult social care. So very much, I think we have taken, one of the key things come across in the consultation responses and that we've flagged internally is that we also need to think about this for children, and children's social care, education, all of that is really key to what we want to see happen in integrated care systems. So I mean, that's a really important point that hasn't been, that's not been missed by us, but a point that I think we all need to collectively keep, making, that, we must remember that integrated care, if we're going to get population health right, we need to do this for all ages. That's just something we really need to push. Again, connected to that, and again, for people on this call will be very, very aware of all the detail of this. How do we ensure that the things described for CCGs, how are they going to work in a new statutory system? Again, I think that's something we need to support the Department of Health and Social Care and others writing the legislation with as we go forward. We need to think about the numbers. So this is something on the clinical side that I know colleagues in children's hospitals have sort of flagged to me as part of the consultation. But we could consider this as part of our sort of population health approach for different segments of the population. What are the footprints that work and the units that work for children and young people? So we have, rare diseases, we have long-term conditions such as asthma that affect, 1 million children. We have different segments within the population. So how does that? And I'll talk a bit more about that in the next slide. And then how do we make sure we get this right? Around inequalities is the big thing that's going to be what we want to reduce. The inequalities that have been widened by the pandemic. I think people have already spoken very well about how vulnerable children, especially, been affected by that. If we're taking a population health approach, how do we make sure that this change in the system starts to reduce some of those inequalities that we've seen over the last year? So this is how we're sort of this is some of the NHS speak and language, I guess, around integrated care systems. So they've tried to talk about this around sort of different population levels, knowing that we have a very sort of CCGs, 200 odd, in very different shapes and sizes. Different shapes again, different population sizes to local authorities. So this is how we've tried to describe at different levels of the system, what functions should happen and which partners on the health side should be involved. So the neighbourhood is more groups of GP practices. At the place, it's more about the health and care providers in the town or district. The system level is more the strategic ICS, and at the region is bringing together those ICSs systems together. So this bit is the bit I was hoping to do a bit more on this, but we haven't quite worked it through yet. But it's almost, where do we start to slot in the children's aspects into this model? So where do the children's hospitals fit with this? Where do our long-term conditions like diabetes fit with this, where most of the care is done within hospital? Where does asthma, which is something that absolutely you would want school nurses to be supporting, more on sort of the neighbourhood place level? So we want to have a sort of a narrative that fits. Vulnerability, I think, would be a key one. Where do vulnerable children sit in these numbers? So we want to sort of, and it'd be good to get colleagues' help with this, I think, as we go forward almost. How do we ensure we have a version of this that fits for children and young people? I'd say we have the beginnings of that, but I think it's something that we need to sort of socialise and get buy-in from people before we have something that I could say this is how this would fit for children and young people. So I think these are the things we're working through at the moment with colleagues internally, and as I say, the great thing for us is to have sort of that external support from people out there and from colleagues such as Christine and Amanda on this. But I guess the good news is at the same time, we are, since April, we've been, obviously the pandemic has taken up a huge amount of resource and time, but we've had a children and young people team established in NHS England. And I guess since the last 6 months or so, we have begun to try and build that beyond the national team and actually work with our regional colleagues and systems to try and build the programme at regional and system level. So, and our programme, this is our sort of elevator pitch for the programme. It's very hard to describe a children's programme because there'd be so many things, and it's compared to a lot of the programmes in NHS England are described around disease. So absolutely, for our programme to be a success, we know it will need to integrate services, we want it to improve them, and we want to be an inclusive programme across all children, young people, families, carers. So that's sort of the first one there is integrate. So I guess for us, the integrated care systems and the changes coming forward are going to be really, really important for our programme. This is governance. So I've only put this up really not to bore people with NHS England governments, but to say that, again, I think this is really important around where does the programme start and where does the programme stop. So and I haven't done a long list of work streams and deliverables in this presentation because I thought we wouldn't have time. I think we would more talk about the concepts of integrated care. But I think one of the things now is obviously how, now that we have a children's programme and that regions and local systems are going to have children's programmes, it's almost how do we work across the different elements of the national. So nationally we have a programme board and that has PHE colleagues, DFE, DHSC, trying to bring us all together around children. And I think we're going to start to see that at regional and local level. And at the moment, there's big challenges around mental health, Scnd, etc. So I think it's how do we coalesce these things around ICSs and local systems and regional infrastructure going forward is going to be really important. So it's not just what's on on my to-do list; it's what's on the to-do list across safeguarding is another really important one. So how do we bring all these things together, and how do we work at governance in what is quite in a way that we probably haven't done before on the NHS side. So integrated care. So integrated care is an interesting term, isn't it? Because we I guess in this forum we would use it and say it's absolutely key, and we would understand why it was really key. I think some of the pushback that we have on it within the NHS is, which I think is fair, is around what do we actually mean by it, and how are we ensuring that this isn't an end in that it's not just an end in itself, that it's an end to improve outcomes for children and young people going forward. So this is our best slide at trying to sort of explain it. So we have the sort of integration within the NHS, which is a big thing for the programme. How do we make sure that paediatrics and child health professionals are there for children in the community? But also how do we make sure that wider integration across local authority services, social care, education, etc. So this is trying to say that they're sort of the model, they're the sort of the concepts we want to bring together, but absolutely within those concepts they are going to support programs of work on urgent care. So at the moment we have a program that has that's come out of the pandemic, where we've had paediatricians working in 111. That's shown really early data evidence that's reduced the need for children, young people, families to go into A&E. So that is an integration program, but it might be called a 111 urgent care program. But that absolutely, the integration there is the key. It's the way the paediatricians are now working with the 111 within the 111 service has been really key to that. Similarly, how we're going to speech and language. How are we going to ensure those outcomes are improved? How can local systems in the future support NHS working with education, the local authorities? And so I think it's really key that we not just describe and the NHS can get very technical and functional about moving money and joint commissioning and moving things about. Those things are really important. We don't want to lose sight of what are the things, and we could fill those boxes in the middle. We could fill that with all sorts of other things. I'm sure that's just my best go at trying to do a spread of things that are very clinical and things that are more around population health. And what are the things that we need around this to sort of enable it? So data is going to be important, technology, workforce, really key to that. So this is our sort of best bet at saying what we mean by integrated care, and why it's not an end in itself, and why it's it is multifaceted, but it's really important for children and young people. Again, I put this slide up. I mean, you don't need to read all of this, but this is just to say that at the moment, I guess we've taken an approach this year with our so we have a regional delivery group now with SROs on. They have been working with their local systems, so colleagues such as Sue, and we've set them this year because of the pandemic and because of the fact that we know local systems for, in terms of children, some are coming from a place where they have maybe already started, they have leadership, they have governance, etc., etc., etc. We know others are starting from a place where they probably don't have much in the way of something for an integrated care system, leadership for children, governance. So for this year, we've sort of said to people, to our regions, go away, work with your systems, report back to us by the end of the financial year about where, we've given some funding out to try and get things moving, but we want them to come back with us to say, we've all our systems have had a go at understanding where they are. And we have they have a plan, they have the leadership now, and we're ready to really, get motoring with the long-term plan, and also with the things coming out of COVID for next year. So at the moment, if you've heard locally, there's probably conversations going on between regions and systems. I'm at a meeting this afternoon where in the northeast of all the local systems, I'm at another one next week in the Midlands. So for me, having talked about this for a long time since the long-term plan was published, it's great to finally, now that we've had some funding sorted out systems and that we have, beginnings of leadership in place to sort of help coordinate this from national, regional to local. It's been, I think to finally get things moving on that has been really great. So I think that again is going to support us. I think with the changes for local systems that we will have within each, I'll be able to, hold a conference like this with all the ICS leads for children and young people, for example, next year. I think that will be fantastic. And here's just some of the must-dos for the system. So, and there's other things we've asked them to do around some of our clinical priorities. We've obviously sent the Scnd funding that Lorraine mentioned is separate because that's within the Scnd programme, but obviously I've been working closely with Lorraine and colleagues on that. But yeah, we've asked them to confirm the leadership, the governance models, make sure they have plans, confirm plans for how they're going to do co-production, and make sure they're capturing the local issues coming out of the pandemic. We think that's really important. It's not just, deliver some things that were in a long-term plan 2 years ago, what you're doing around things like digital poverty and what we're doing for the most vulnerable children. So I think there is a real opportunity to galvanise what we're doing within our programme with all the work that's going on with colleagues on this call and across with the Scnd review. So I think there's a real job at the moment to try and put the LEDSOM review that's been going on for early years. There's a lot going on at the moment. I'll stop sharing my screen. There's a lot going on at the moment. So for me, it's how can, I'll be really grateful for, people's support on how we, as we move forward with all of this, how we get it right and how we use the opportunity we have with, the programme and the resources around that to make sure we get all of this right for our children and young people.
Thank you, Richard. That's really helpful and a huge amount of information to take in. No, that's fine.
Sorry.
Going on. And not surprisingly, there are loads of questions. And I think a lot of the questions are, this is lovely, but how will it happen in practice? So you've got lots of questions about the linking between children and adult services as we go 0 to 25. Lots of stuff about, please tell us you're not losing community children's nurses. Stuff about the DMOs and where it fits. So lots of stuff about the practice happening for children and how that goes forward. And a really big question, I suppose, which is about how do we engage in this? How do we keep up with this? How do we know what's happening?
Yeah, so I think I can help with that. So I'm really happy to support linking through Christine and Amanda, but with other colleagues. But we have a regional, obviously I meet every month with all the regional leads that are now in place. So that's also a really good place just to get on the agenda with them, and then so they can understand how they need to support the local systems. So it might be that we want to have a session on Scnd or vulnerability with them at some point, because I think that would, and to me, you see, they are what's been really, although these are NHS England leads, most of the things they raised for me have been around social care, vulnerability, prevention. They want to know what is our role in this, because you've made me a children's lead, but we know that the NHS isn't the solution for all of this. So we need to be able to know what can we do with some of the deliverables and funding you're giving me that is actually going to make the biggest difference. So yeah, I think we need to. So I'd be very happy to look at how we do more join up on that, because I think it would be really helpful.
And I suppose we've got a CCG here coming back, Terry from Bassett Law, saying, do we know who the regional leads are for the transformation plan? So if you are currently on this call and you work in a CCG, are you confident about who you would need to talk to and how you would get engaged? And is that information available for people, Richard?
I can share, yeah, I can share that. I think we need to be a bit careful that there's our regional leads and there's also Scnd leads. So we just need to I think that's where we need to do some of the alignment.
I think that would be really helpful. And I think the other thing that's coming through very strongly on the chat, and we'll sort of catch up with this, and what I've said to people is this is the first of a number of conversations, I think, is that one of the challenges in working with integrated care is often the NHS defines integrated care as integrated in itself. So actually, you know, which given the complexity of the NHS is hardly a surprise. If you can link primary and secondary care and specialist care, that's brilliant. But obviously lots and lots of the calls are coming in about how does that integrated care in an NHS integrate with a more holistic system around social care and education and participation and young people's needs. So it's that sort of next stage planning, I suppose.
Yeah, so I think so, absolutely. So I think on that, the slide that we have, the horizontal and the vertical, we are saying this isn't so absolutely. Paediatricians working in 111 is really important and complex, but we want this to be the wider integrated care. And one of the things that we've said is when we're talking about leadership, confirm the leadership for the ICS for children. We don't just mean NHS leadership. We mean public health, social care as well. You know, we want how you, and that might take, you know, you might not need a director for each of those posts, but you're going to need a governance model that does bring all those people in.
Yeah.
So, well, that them all be at the moment.
Excellent. And Lorraine's coming back saying she'd be really happy to do some of that sort of stuff and bringing that together. And I think bringing the Scnd and the transformation leads together for people to talk to would be great and really, really helpful. And I suppose there's a bit of plea in the system, not surprisingly, that can we have space for leadership for children? I did some work for the NHS on Monday, and it was the first time I'd seen some of the ICS footprints. And I suppose I hadn't realised just how big they were. And I was thinking, geez, how do you pull that together? So, you know, one of the things for me on ICSs that now cross a number of CCGs is, can we hold all the DMOs? Let's not then filter it down so there's only one. And how do you have leadership for children across these much bigger footprints and systems, really? And it really struck me on Monday, just doing a piece of work on one of the programmes, Richard.
Yeah. Yeah, absolutely. I think, and that again, so we've been going around having regional, so we've had deep dives just to check people know what they're doing in each region and to sort of get a bit of a feel for what each region, the challenges are. And that's been one of the really, each of the 7 regions has a different number of ICSs and has different geographical scales. So within, although they might say in one region they've only got 3 ICSs, say, they're going to have to break those down within the ICS for their leadership and how they're going to structure the way they work. So I think that's why I showed the slide with the population levels on, because that's probably more key than what the map looks like. Yeah, I suppose the strong thing coming back, as you say, is this is about partnerships, and you do partnerships at levels in the system, don't you? You know, otherwise you lose partnerships. And I think one of the really strong themes that's come through on all our work for the last however long is actually the best of the programmes that we're looking at across the piece are those based on strong local partnerships where people understand need and then they can work together. So it's just sort of not losing that. Yeah, I think the challenge for me, and I've tried, this is what I'm trying to do, is to give people the space and the resource and the leadership and the space, but also if they to also say, you know, we need to report back to my masters to say we've delivered on the long-term plan and you know, my asthma outcomes are moving, etc. But I want this to be about population health as well and about local leadership.
Okay, and I suppose for those of you who've ever been involved in legislative change before, you will know that there are huge opportunities as things become in the legislative system to influence it and change it and make sure it works. And I have no doubt that CDC, working in partnership as always with a range of agencies, will be supporting that legislative change and making sure that any change that goes through promotes the needs of children and young people. You know, Richard's already said to you that actually the amount of people coming back on the first consultation who said, please don't leave children, please don't lose children, please don't lose children, made a real difference for the ability of staff within the NHS to actually then go and say, there is a really important constituency here coming through. So it's also for us as people who influence the system as well as people who work in it to be able to keep that pressure up in the way that's appropriate. Yeah,
that's very helpful, Christine.
Good. Okay, right. One of the things we are going to do, as you can imagine out of this, is the health stuff is really big, really important. So we're going to do some more work on this as we go forward, and we'll work out how best to do that. And we're always really pleased to work in partnership with both Richard and Lorraine. And you will see that on the chat coming through that one of the things that we'll send you is the slides with the leads on and who the leads are, and making sure you know who those leads are so that you can contact them, and then we'll come up. I think though now what we'll do is we'll move on to Sue. So really pleased that Sue's here, because Richard's now talked to us about this from the national team, and that's been really important. Sue's been making it happen in Wakefield. And so,
we're at the starting
really
point,
pleased.
Christine. Thank you.
I'm really pleased you're with us, because I think sometimes the sort of national picture loses people a bit. We have to come down and say, okay, in West Yorkshire and Horrogate Health and Care Partnership, I can now see, what have you been doing, Sue, for children and families, please?
Okay, so I'll tell you a little bit about my background first of all, which I'm just so delighted to be here this morning. I can't tell you, because my background is I am a children's physiotherapist by profession. Worked for 20 years in the NHS, and then I moved into working in commissioning. I worked at a PCT back in the day, Richard, of PCTs. I used to manage services and I used to commission them as well, which those were the days. And also I've worked in local government. So I've worked 14 years in local government, just recently left Leeds City Council. So an understanding of the whole system is something that I've been very fortunate to have over that time. And 18 months ago, I went to a presentation about the West Yorkshire and Harrogate ICS. And guess what? They didn't have a children and families programme. So I went and approached the chief executive who leads on, who used to be a boss of mine at the PCT, and said to him, Rob, why isn't there a children and families programme? He said, Sue, we need one. And would you like to put forward a proposal? So that's what I did. And we then created a post 2 days a week, which I was applied for and was successful in. And for me, this is absolutely bringing together all of my experience as a professional in health, and also my experience in local government. So it's absolutely fantastic. So we've developed this programme in partnership. I'll explain who we've got on the programme board, and we've got work streams which I'll go through in a second as well. But we absolutely focus on, and really interesting seeing all the questions in the chat. There are 3 things that we focus on as an ICS. The importance of place and subsidiarity of place is really important for the ICS. But also there are 3 tests that we won't do anything unless it fits into these 3 categories. The first thing is, what could we do at scale? So what can we do together? And we have got some examples of how we're commissioning at a West Yorkshire and Harrogate level, and the CCGs coming together to agree to join the commission, and I'll go through some of those in a second. What wicked issues have we got that we're dealing with together? And clearly COVID has been one of those, but all sorts of other wicked issues around children and young people. You've talked about inspections, Ofsted, tribunals, all those kind of things are really common issues that we're dealing with together. And the third one is, how do we share best practice? And that's something, again, that is, as an ICS, is really important for us. So could I have the next slide, please? So what we did was we created a vision for the Children and Families programme. And when we see this vision, we're talking about all children and young people here. So we're talking about closing the gap in health and wellbeing outcomes. So very much a health and equality focus there. And we know that the lived experience of where children were born or where they live and go to school is very different. Certainly when I worked in Leeds, one of the things, you know, one of the sort of the focus that we had was Leeds was a tale of two cities. So there was an incredibly affluent part of the city and a very deprived part of the city as well. And so we had to focus on how do we improve outcomes for all children. And that's what we're looking at right the way across the ICS system. And we have got the same picture across the ICS around deprivation and affluence. So we're also looking at this as a whole life course piece of work as well. And really interested in colleagues' contributions in the chat around transitions, because that's the fundamental one for us. But we're looking at Best Start in Life. So we're working with the maternity programme around Best Start, and how do children get their best ever start, and the support and healthcare to enable them to be safe, to have healthy lifestyles, and to do well in learning. And that's all children, so that includes those with complex needs and SEND as well, and having the skills for life, so moving on into adulthood. So that's fundamental. Now, the voice of the child is at the heart of everything that we do, and we have a group already of young people, and we do have some young people who've got additional needs on that group that meet every 2 weeks, and they are fantastic. They feed into the programme, and they're from the whole of West Yorkshire, so they're meeting virtually, and really are part of it. It's a fundamental for us that children and people are at the heart of what we do. Could I have the next slide, please? So this is the question that we ask, and we know it's a very different answer depending on where you live, where you grow up. How can we make it better? And the way that the systems have developed over time, there's a different experience for children and young people depending on where you live as well, in terms of intervention and healthcare. And those are one of the things that we've really looked at in our ICS programme, and I'll come on to an example of that to talk about the SEN. So I love the photograph, obviously. It is really cute, isn't it? I think it's a he. Oh, it could be a she. But so let's move on to the next slide. So we established 7 what we call priority work streams, so 7 working groups. Yeah, delicious baby. 7 working groups that are and there's loads of interdependencies between these groups. The first one is around acute paediatrics. We now call this the Child Health in the Community programme, because this is about reducing A&E attendance, reducing hospital admissions, and also because the stat that really sticks in my head is that children who are admitted to hospital, 95% of children stay less than 24 hours. So how do we support families to ensure that they are, able to manage their child's condition? And that's, in all aspects. Best Start in Life and narrowing the obesity gap. So this is very much led by public health, and we're looking at working with the maternity programme, breastfeeding, good parenting, great start in school and learning, and also how we get that sort of focus around activity, good diet, etc., 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 to ensure that children are emotionally ready to learn, got good communication skills, etc. So all of those things, Best Start in Life, really important. Complex Needs in SEND group is just being established. I'm leading on that one because of my particular professional background. Fascinating that we are going, what I'm doing at the moment is I'm doing some scoping work, looking at how each place goes ahead around early intervention, diagnosis, early identification of problems. How do they then do an assessment of a child, a multidisciplinary assessment? What does that look like? And the agreement is that we are going to be looking at how we can do that in a more of a consistent way across the ICS, so that we get a consistent approach. And that's going to be fascinating. I'm really interested in that. We had some feedback when I was working in Leeds at the council from a parent group called SNAPS. And you know what? It was quite distressing, the feedback that we had, that some parents were saying they felt abandoned, that they hadn't seen. I spoke to a parent who's got a 2.5-year-old son who's 60% developmentally delayed in all areas. And she said she hadn't seen face-to-face a therapist for 9 months. So her son hadn't had any intervention. The speech therapist had rang a couple of times. She'd been in to have an orthotic assessment, but that was it. Nothing at all for 6 months. And sorry, 9 months. So you just think there's going to be some real, I think, consequences of COVID. And I know that nationally the letter came out to organisations to say, stop taking your therapists off children's services to work on adult services, because they need to be focusing on children's services. I thought that was absolutely the right thing to do. So there's a huge amount of work to do around that, and I'm really interested in working with CDC because that, you know, in terms of how the approach that we take, and there's a lot to learn from other places as well, I'm sure. We've got long-term health conditions. We're focusing on the 3 in the long-term plan: diabetes, asthma and epilepsy. We've got a working group for each of those, clinically led, but working with colleagues from local authority where appropriate. And also diabetes in school. How does a child who's got a sensor to manage their blood sugar, so they understand what where their blood sugars are doing on their phone, but the child is not allowed to see their phone during the day? So there's a whole range of things there around education. We're also looking at asthma in schools and asthma management in schools, because again, some children aren't allowed to keep their inhalers with them during the day. They have to have them locked away. And so there's linking in with schools is a really important one there. The mental health, LD and autism group is a group that already is in existence in the ICS, and it's got a children's mental health work stream. That work stream now reports into our programme, into the Children and Families programme, and there's a huge amount of work going on there. And we are seeing that we're looking to commission jointly an out-of-hours crisis line for children with mental health conditions. So that's one example of a West Yorkshire and Horrogate commissioning approach. And the commissioners have come together as a group. They're working on how they're going to jointly commission and look at that. So that's a really interesting one. But for me, I'm a foster carer. I know what impact the behaviour of adults has on children. And so we also want to work with the adult programme about how they work with adults and look at trauma-informed work. So what does the behaviour of adults, how does that traumatise children, and what long-term effects does that have? So that's another element of that work, which is absolutely fascinating. Family resilience and early help. This is very much led by local authority colleagues, and we're looking at working with health visitors, school nurses, social care, intervening early, supporting families early in the life of a problem. How can we work early on? And that has a real resonance with SEND and complex needs as well. You know, so identifying children who've got developmental delay early, or maybe who might be showing some signs of maybe cerebral palsy or other conditions, is really important. So we've got a health element into that as well. And then finally, we are linking in with the Yorkshire and Humber Palliative Care Network with the other 2 ICSs. And we have agreed across the ICS that the CCGs are all matching the funding that's come down for palliative care. And we are funding a specialist team at Leeds Teaching Hospitals that's going to support the whole of the ICS footprint around children who've got a life-limiting condition. So that's something that's been a real positive for the ICS. And we're also going to be looking at expanding children's community nursing across the ICS footprint with that funding in the next tranche that comes through next financial year. Fingers crossed that that happens. And, you know, the palliative care network will also link into acute paediatrics, We're looking at establishing a system within that work stream, acute paediatrics, of using a device called Tyto, which is a digital device that will take readings. So a family could have the device at home and it will monitor the child's respiratory. You can look in the child's ears, in their throat. You can monitor the heart rate, and that information can be streamed to a paediatrician to make decisions about the child, about whether the child needs to be coming to hospital, if they're coming towards end of life. Is that would a family decide that the child needs to go into a hospice if that's their decision? So there's a whole range of links between the programmes. And as an ICS team, I'm the director, but I have a team of 3 colleagues now who are working on these programmes, and we link all these different things together. So it really is, you know, evolving work. We've been going for just over a year now. And we're really starting to evolve the work. So could I have the next slide, please? So in each work stream, what we're looking to do is each work stream has to consider each of these elements. So the voice of the child, obviously, and young person is absolutely key. How we engage with families. So what's the lived experience of families around you know, their child's condition, and particularly during COVID, and learning from that as well. We also focus on vulnerable children, so children living in poverty, children looked after, care leavers, and that's something that's, you know, really interesting. And we've got transitions in each work stream as well. So we are looking at creating a bid for the new expressions of interest that's come out from NHSE to look at transitions in all of our work streams, because we've got some real issues around transitions. Diabetes, we haven't got a really clear pathway for transitions from young people, from children's services into adult services, one example, but also transitions around children who've got a life-limiting condition. I declare an interest, I'm a trustee at a hospice, and we had 50 young people who are over 25 being cared for by that children's hospice, because the adult hospices, there wasn't a pathway for those young people, say for example, who had muscular dystrophy. In my day, if you had muscular dystrophy, you got to 20, you were doing really well. We've got lots of young people now, young adults, who are in their 30s with muscular dystrophy, but the adult hospice network is just not set up to support those young adults. So that's the real focus for us around transitions. Workforce obviously runs through the thread through every single of our work streams, and how we engage with the third sector as well is really important. So we have a group in West Yorkshire called YCAN, which is the West Yorkshire Children with Additional Needs Network. Fantastic linking in with the Scnd group, and there's about 50 third sector organisations in that group that support children with additional needs. Amazing. And we've got all sorts of other third sector organisations as well. And the fundamental is around early intervention and prevention, and that's a fundamental for each group as well. So those are the work streams, and then the final slide, just before I show you the plan on a page, shows you the structure of the board. And you know, Richard's question earlier about how you establish that partnership approach. So we have on our board, we've got local authority representatives, so assistant director reps, so in a similar role to I had, people who lead on health in the local authority, CCG commissioners who come together as a group and on the board, public health rep. WIAT is the West Yorkshire Association of Acute Trusts, and they have a children's group that is represented on the board by a fabulous paediatrician, Saluka, who's just amazing, and he really does bring a focus around paediatrics into the board as well. We have clinical representatives, paediatrician, allied health professional who just happens to be an OT, the lady who put your chat on there happens to be an OT, and we also have nurse as well represented. We have a GP on our board who is absolutely amazing. She's from Calderdale, but she's a GP part-time. She's also a commissioner of children's services, so she absolutely gets it, and she's fantastic. We haven't got anybody from NHSE SpecCom. We did want someone, but we haven't got that. and we've got a voluntary sector rep who represents the West Yorkshire voluntary sector organisations as well. And then the providers are represented on the working groups, which are on the green strip in the middle. So the working groups that I've talked about. And we've got a link into unpaid carers as well. We don't have a DCO on the board, but it's something that we think we probably will have to look at. And that's a really good suggestion. Thank you for that. So you can see where we're linking into the mental health and LD and autism group and the unpaid carers group. And all the interdependencies with YAS, which is the ambulance service, Directors of Children's Services, absolutely critical for us to link in with. And we had an assessment by an assessment earlier on, just before Christmas, to look at acute care. And one of the things that came up was the concerns around safeguarding. And so we've linked back into the Directors of Children's Services group around that. Children's clinical networks across the piece, primary care network we're linking to, neonatal care review, cancer programme, urgent care programme and maternity. So that's how the children's programme sits within the ICS. Could you just put the plan on a page up for me, please? And just so to see how it all fits together. Thank you, that's brilliant. So this is the plan on a page, how it all fits together, and it's very much about the bubbles in the middle of the work streams, the vision you can see there that I've been all through with you, the values and behaviours along the bottom, voice of the child and family, work in partnership is a principle across health, schools, care and the third sector, focus on the most vulnerable children and young people, and intervene in early life in the life of a problem. So, you know, that's something that is fundamental. In terms of parent carer forums, YCAN very much involves parent carer forums, and we've got the carers group in its widest sense will include parents as well as young carers as well. So very much about how we do that. So that's kind of what we do. In terms of how we know we're making a difference, we're looking at a set of metrics, and I'm waiting. We're getting a business intelligence colleague who's going to be joining us in the team, so we can establish a set of metrics for each programme. So how we know we're making a difference, what we measure it, what does that look like, and some of it's much more well developed than others. So that's where we are. And I'm quite happy to answer any questions anybody's got.
Oh, thank you very much. I think you've cheered a lot of people up, actually, Sue. No, really, it's been really interesting watching the chat, though my system is playing up. And actually, I think what you've done is you've translated what Richard was talking about and shown us how it's working in practice. Yeah. So the biggest question on the chat is, please, can we have, Richard, lots of Sues in every ICS?
I know, I was going to say it'd be very easy for me if I could just send, if Sue could be cloned and sent to every ICS.
I think the big thing is that the programmes seem to make sense for people coming through, that actually the way your work streams work and the links make sense for people in terms of coming through. And I suppose the big questions coming through are really about, how did you get here, Sue? What were the key enablers that enabled you to deliver what you're delivering? Because what you are delivering, quite frankly, is the vision that we want to see.
Okay.
So apart from sheer dogged persistence and not letting go, Sue, which we can tell shining out of you is one of your characteristics.
Yeah, I mean, for me, I think my background has really helped in terms of, you know, I understand NHS. I've worked with children and families directly, so I understand that. And I've worked in schools, I've worked in local government now as well. And I have to say, I want to pay a massive tribute to our Director of Children's Services in Leeds, because I have absolutely copied the Children and People's Plan from Leeds in the format that we've used for the plan on a page. And it's very much about using something called outcome-based accountability methodology. So how much have we done? What have we done? What's the quality of it? And how do we know it's making a difference? So that's what's driven this work. And I know a colleague is joining us from Leeds, joining our team, and I said to him, if you look at the plan on a page, you might recognise it. And it fundamentally is how we've worked in Leeds. And Leeds is an outstanding children's services. Come from a position of being inadequate when I first joined in 2011, and we moved through into a position where Leeds is outstanding now. But the approach we've taken was about working in partnership. So working with health partners, commissioners. I mean, I was the health lead for the children's services team, and it's just been a phenomenal journey. And so moving into this area, it just made perfect sense to create these different elements. And I did lots of consultation. I went and spoke to every place about what they thought the priorities should be. And we got agreement really quickly that this is how we should be doing it. And when somebody asked the question about how long has it taken, I started working in September 2019, and I do 2 days a week on this programme. The rest of my team are full-time, but I'm 2 days a week. And so we established this when I was seconded from the council, and it's gone from strength to strength in terms of an approach. And some of the work streams are really far ahead. Others are just getting established, like the Scnd one. We're starting to work on that now. Scope it. What will it look like? Should we be? And just give you one example. We've been looking at fetal alcohol spectrum disorder, and I know that's a very specific condition, but the commissioners were coming up with real concerns about the fact that in some places they don't have a FAS service, and we know the impact, well, I know personally because I've experienced it, of alcohol use in pregnancy and what damage that does to babies' brains, and what then long-term consequences that has. And often it isn't diagnosed until the young person is in the teenage years, which is often too late. So we're looking at FAS, we're looking at how we, I've got a clinical working group that's cracking on and looking at diagnostic pathway, what that should look like for each place and how it should be done in each place, and how we link in with CAMS where appropriate, and also commissioning a service across West Yorkshire and Harrogate. So, you know, for early intervention. So there's just one example there of what's dropping out of these conversations. And the FAS conversation came out of discussions with commissioners, and they all agreed that it was a bit of a wicked issue that we needed to look at together. So that's how it's evolved and developed.
That's really, really helpful, Sue. One of the other things coming through the chat, and I suppose this is sort of a question for you, but also for Richard and Lorraine, which is, so one broad question is, how do we now take the learning in terms of your development, both the things that have worked and the things that haven't, and we use that so other people are not stuck in the same place working it out. And then the second thing is that what shines through is the voice of the child, and the active engagement of young people at every stage of the process. So how do we replicate that? How do we learn from that? How do we make that happen, really? Richard,
so I think,
coming in?
Yeah, I can have a go at that. So I think sort of my very confusing grid of where maturity for ICSs is basically saying also we want to make sure that the areas that haven't had a SU and haven't been able to get going, can we give them more support? But also the areas that have had a SU and have had some funding and been able to get going, we want to get the learning from that. And actually we're part of what we're doing there is we don't want to punish people that are already ahead. We want to give them some funding to go further and to, you know, I know we talked about integration pilots last year. It would be areas such as this where we would say well, they're the areas that can go further faster now, we can get the learning.
Yeah.
And how's that learning going to be shared, Richard?
So I think we would want to do that. I think we'd have to do that in a number of ways. So we have like a futures platform that we're building for the programme which will be internal to NHSE and also external. But we'd want to, you know, what I really want to do is make a we haven't really, I alluded to at the beginning that a lot of the integrated care vanguards, someone mentioned vanguards have been mainly around adults, haven't they? So I really want us to make a big deal about areas that are doing more for children and doing this.
Yeah, I mean, for me, I looked at the white paper, I've read it all, and I did a word search because I thought, how many times are children mentioned in the white paper? Three times.
3, yeah.
Obesity and children who are in, I think it meant that they've been in young offenders institutions. That was it. And we talked about social care a lot, but actually, when you read it, it meant adult social care. It didn't mean children's social care at all. And there was no mention of children with complex Scnd, life-limiting conditions, any long-term conditions. There was nothing about that really at all, which I thought was disappointing. But we can adapt the approach in the white paper to the children's programme. And I, work with Richard, and we've got a meeting this afternoon with the Yorkshire and North East children's group to talk about how we're going to take things forward.
I'm coming to that for a bit, Sue, as well.
Oh, yeah, you're great. That's great. Yeah.
And to be honest, we're used to children being left out. 40 years I've been doing this job. I don't know how many white papers, green papers, or anything else I've read where I've got to chapter 96 and thought there must be a reference to children here somewhere. So we're used to that starting point almost, but that for me gives us a building point. We then say, actually, do you know what? This works. And it goes back to what we were saying before. One of the things I think we'd like to offer, Amanda will probably be horrified because I'm not meant to offer anything, but, is actually, I think it would be really good to do a session on learning from some of this with people. It's just so exciting and so interesting, but it would be so easy to get it wrong. And so easy for people to decide this is too difficult or we need this or whatever. So lots of agreements. I wouldn't mind if she did the work. What a cheek. There's quite a lot of agreement coming through. So Richard, if you want to have a think with Sue and with others and with Lorraine, how we can do some further work, not just obviously it's really, really important for those people on this conference who work for CCGs that this happens, but it's equally as important for those people who work in local authorities, the parent carer forums, etc., to understand the opportunities for this, etc. So I think that would be really good. There are various things going through. I'm going to bring us to a close so that we can have a break. So so thank you very, very, very much, Sue.
Pleasure. Thank you very much for inviting me.
No, you can come anytime. I have my instructions now. So one of my instructions is that obviously the speed at which a chat moves and the way things work, there will be questions within the chat, both for the DFE, for the NHS, etc. we will have not answered. But what we do is we capture the chat and we will follow it up. So we will come back in terms of questions and issues and whatever. And also what we will ask of people like Richard and Lorraine and Fiona and everyone else is actually if they've got additional material that could be sent out to this group in terms of what they're up to, in terms of contacts, in terms of information, then please use this group to do it because they are passionate and interested, which is why they keep sending me messages. So we will do that. Yes, and Sue, I'm sure. Sue, there's lots of things about, please can you share your slides? Do you mind?
Absolutely, of course. I'm happy to share them, yeah.
Brilliant. Okay, so after the conference, we will pull together what's come through the chat. We will pull together what's come out of the sessions, and we will do that. If you would like more of these sessions and us to continue doing the job we do, we would be incredibly grateful, and hopefully it'll appear in chat by magic, for you to fill in an evaluation form. Because we have to prove to our financial masters, or in this case the DFE, that actually the sessions that we put on are useful and helpful, and actually we would like to continue doing them as we move specifically through this really key area of change in both the NHS and the Scnd review. Amanda, is the link to the things? Aha, thank you very much, Marie. So what we have behind the scenes is we have a wonderful Marie and Daphne. Marie and Daphne are the people that make the technology work, amongst other things. I do not, as you can gather. So Marie's put the slide up in terms of evaluations. I'd be really, really pleased if you fill it in. You can say what you like, etc.
We've also
Now, the
got a last poll, Christine, just asking people, hopefully we will be able to do more of these, but just asking people what they might want us to focus on next time round. So, Marie, could you put the details for could you put the poll back up for us? And then, sorry, Christine, back to you.
No, that's fine, that'll be good. Yeah, have we got the focus right? What's useful? What's next? These agendas are designed to meet your needs, hopefully. Okay, so we're going to do evaluation, we're going to do the poll, and then in a minute we are going to have a break. And after the break, you will be in workshops. You should have got your Teams invites for 2 different workshops. As always, we are really grateful for those people who offer to run workshops for us. Don't be shrinking violets, the rest of you. We have so many people who are doing really good things, but don't want to tell other people about them until they're perfect. So if we were waiting for perfect solutions, we'd have very quiet conferences. So really, really grateful for those of you who offer to do workshops. And again, if you're looking at the workshops thinking, I want to do all of them, then we will send the materials for workshops as part of the package to do it.
Just to remind people that they're all being recorded, so if there's any that you wanted to go to and you couldn't, then you can still watch them. And if you are going to a workshop, don't fill the evaluation form in yet. We're just putting it up now because we know that some people aren't able to stay for the workshops, so please do fill it in now if you have to leave. If you don't have to leave now and are going to a workshop, then we'll get you to fill it in at the end of your second workshop. Thank you very much. So Marie, do you want to put the poll up now?
Oh yes, please, Marie.
I can do that, Marie. Thanks.
So just a reminder, what do you want us to focus on next time around? This might be linked to the thing that's keeping you awake at night. It might be linked to the thing that you're proudest of. You might be offering to share what you're proudest of at the next event.
It's gone very quiet, Amanda.
It has gone very quiet. It's because we're not chuntering, Christine. So, and people do, don't feel that you have to sort of stay and watch the screen. If Christine will close the session and you can enter the responses to the poll as you put the kettle on.
Okay, and yeah, all right. So what we like to focus, yes, I am. Oh, nice way of doing it now. This one, isn't it? Okay. We've heard today some fantastic work involving young people, and part of our philosophy at CDC is very much reflected in what Sue said earlier about children and young people's voices at the heart of what we do. So maybe one of the things we will be looking at next time would be about the voice of young people, and look at that on outcomes. Well, luckily the team does a lot of work on outcomes, and there are some really useful pieces of works going on. Gosh. Okay. Somebody at some stage is going to make this word cloud make sense. But we will do, and we will take it away. Amanda, in terms of our timeline, when is the next event likely to be?
I was about, well, that's something people can put in the chat as well. I was thinking May, it just in that will, we should have a better idea about where we are in the COVID recovery cycle by then. And whilst we can sort of focus on those longer term issues, there might be some shorter term concerns that people want to address as well. So if May feels about right, let us know. If it doesn't, then let us know that too.
Okay. All right then. Okay, we are now on break. We'll keep filling in on the poll and whatever, but we are now on a formal break, so we will bring this formal major session to an end. Do you know, I've really enjoyed myself. Thank you so much. It's really fascinating to hear. And thank you so much to all our speakers. We get really, really busy people. And then basically we say, please give us time in your incredibly busy days. And they do. And we are really grateful for that, because that's what makes a difference. It's also fantastic that they hear one another. Thank you for the kind words on my chairing. There are times it can be slightly idiosyncratic, but there you go. But it's been a really engaging, important event. I just have a page fulls of things that we want to do next. So enjoy your tea break and enjoy your workshops. And I will see people in the workshops that I'm in, and I'm looking forward to my next stage of my learning. So thank you very much indeed. Take care.
And just to remind you, your workshop starts, the first workshop starts at 11:40. So look at that for a generous break, Christine.
13 minutes, time to get a cup of tea. All right, then take care, folks. Thank you.